Hello and welcome to the Body Mind Biohacker Podcast. Today we have a special episode about holistic oral health from one of the foremost biologic dentists in the country. Hi, my name is Ryan Kimball. I'm a ketogenic fasting health and a life coach. In this episode, you will learn some extremely valuable information you can use right away to improve your dental, oral, and overall health.
All right. Hello, everybody, and welcome to this week's episode. I am so excited to introduce Dr. Carver. She is a board-certified biologic naturopathic dentist and a certified health coach. And she's here to talk to us about some things that we can use on our day-to-day lives as far as dental hygiene, improving our overall health. It's really an amazing topic, and you're probably going to get a lot out of this you didn't even know you didn't know. So without further ado, I'm going to let her introduce herself and go over what all of this means exactly, and we'll go from there. Thank you so much. Hi, Dr. Carver.
Hi, thank you, Ryan, for inviting me. I appreciate it.
Absolutely. Thank you for being here.
So just a quick thing about me is I graduated from dental school almost 20 years ago, the conventional route, and I practiced, conventional general dentistry for about 5-6 years until I had my second daughter and ended up with eczema all over my hands. And, of course, I went to the dermatologist. They just wanted me to be on steroids, and they kept changing it when it would stop working. And at the point where they prescribed me a immune system altering cancer drug, it was my aha moment. And I said, wait a minute, what came to my mind was my body is trying to tell me something. I just have to figure out what it is. So that launched this 10-year long, span where I was just trying to understand what was happening in my body. So I said, I fired all my conventional doctors and I just started reading. I said, I'm going to figure this out. And so, through many different supplements and doctors and techniques and little tools, eventually getting into nutrition. So then that's when I went to the Institute for Integrative Nutrition and got the health coaching degree. And then started to think about, as I was getting better, started to think about dentistry differently and thought, is there a better way to do dentistry? And I've always been a very curious person. I've always wanted to know why. Why is that person getting a cavity? Why did that tooth crack? There has to be a reason. These things don't just happen. And so that it started me down a journey of learning all these other avenues. I spent a year learning about the bite and how that plays, because in dental school, we learn about the bacterial component of cavities and gum disease. We don't learn a whole lot about how the teeth are supposed to come together. We don't learn anything about the airway. That's another really, really big topic that's getting more and more emphasis these days about recognizing improper development. And that's something that's really exciting. And we can recognize that in children even and create a lot of good growth before the typical wait till you're 12 and then we'll do braces. Right. So I started to learn about ozone. That was one of the first things that I learned about because I was going to a practitioner to try to help myself. And I saw a course on ozone for dentistry. And that led me into the board certification naturopathic curriculum that I did for 1.5 years. And we learned all sorts of things like homeopathy, nutrition, functional medicine, really looking at the root cause of things. I started getting into energy medicine, which to me really blew my mind. And I really think the energy medicine is really the future of medicine. Really, I was just listening to a summit, it's a global energy summit actually. And one of the speakers was talking about how way back, in the 14th century or whenever it was, church and state became very separate. So anything to do with the mind and the thinking and the spiritual, right, became property of the church, and science was all about the physical. And still to this day, that perpetuates. And I think all of us probably know somebody who has miraculously healed from cancer or healed from, and we call it a miracle. But if you really delve into the whole energy behind stuff, there's so much to it. And I see that in my dental practice too. So that's the other really cool thing about dentistry. We talked about the mouth as a mirror to the Surgeon General actually came out in 2000 saying that the mouth was a mirror to the rest of the body. And so I take that very seriously. And when I am, diagnosing my patients or working with them, I'm thinking about the entire body.
Wow. Amazing. Okay. that sounds pretty all encompassing. So if I'm duplicating this correctly, you can look at a person's mouth and just by that, see what's going on with the rest of their body to a large degree.
Right. So if we think about, where does the gut begin? Everybody these days, or most people, are very familiar with the term leaky gut, right?
Yeah.
And that was one of the first things I read about back, 11 years ago now. And and I knew, something is wrong. My first experiment was taking wheat out of my diet for 4 weeks, and it cleared my hands 90% of the way.
Wow.
No steroids, nothing, just changed my diet. So that really propelled me to keep learning. And so the tissue that lines the oral cavity is the exact same tissue that lines the gut, right? So the gut begins right in the mouth. So with all my training in Chinese medicine and Ayurvedic medicine, there's a lot of tongue diagnosis you can do. So you have a person sticking out their tongue. Do they have cracks down the middle of the tongue? Is the tip of the tongue red? Do they have teeth marks on the tongue? Is it coated? Is it yellow? Is it white? Is it black? All of things can tell me about what's going on. And in Chinese medicine, they also mapped the tongue. So if you have a red tip of your tongue, that's related to the heart. If it's on the sides of the tongue, that's liver and gallbladder. So you can also, intimate what's going on. Same thing with the teeth. All of the teeth lie on those Chinese meridians as well. So one of the things I've seen time and time and time again is an upper first molar that is abscessed, infected, that is on the breast meridian. So that I've seen it in my own practice many, many times, that being related to breast cancer. So if you think about it, any infection in the mouth is draining. It drains through the lymphatics right into the chest. So it's really, really important. The other thing that so much of this goes unnoticed, because you could have an abscessed tooth and have zero pain. So you would have no idea. And certainly your physician isn't going to be looking in your mouth when they're trying to, figure out what has caused your breast cancer. But that's something it's really important to be aware of, that there are some naturopathic doctors who will say 80% of disease begins in the mouth. And it's because there's so many toxins and infections that are lingering there that are affecting the vagus nerve, which is the nerve that runs kind of behind the ear and innervates every single digestive organ. So let's say you have a root canal tooth that maybe you feel fine, you can chew on it and everything feels good, but there may be toxins at the bottom of that are draining through the lymph down the neck, affecting your vagus nerve, which then shuts down the acid production in your stomach, which slows down the motility of your gut. Therefore, the slower you digest, the more toxins are released and the more they're able to just kind of recirculate. So many people are constipated. They think it's okay to go once or twice a week when you should be going once or twice a day at least, right?
Yeah.
So really, really important that the mouth has to be considered in any kind of chronic ailment that you may have.
Yeah, that's actually really amazing. I never related it's Hippocrates that says all disease begins in the gut, I believe. And that would include the mouth, because that is part of your digestive tract. So,
exactly.
Wow, all disease. So the beginning of where all disease begins is the mouth.
That's right.
Basically. Okay, cool. Wow. Amazing. Okay, so now I want to go look at my tongue in the mirror and see if I have any red spots or anything. But I guess a person could do that theoretically, is learn a little bit about what their mouth should look like and then see what's going on. And even if they're seeing somebody, then supplying that medical or healthcare professional with that information could be helpful.
Yeah. And I mean, it's all over the internet. You hit tongue diagnosis, you'll get all sorts of little maps. You can find a ton of them. Most, doctors, even most dentists will have no idea what you're talking about. Because again, this isn't a typical part of our training. Okay. But again, I'm a huge researcher, and I've spent 11 years trying to learn as much of everything as I can. I live in a community, we don't have a lot of holistic practitioners. So I've had to learn kind of everything for myself and for my patients. So, but there are so many great resources. And one thing we were going to talk about when we talk about leaky gut, again, most of you are familiar, though we also talk about leaky mouth.
Right.
So again, the same thing, if you're familiar with leaky gut, basically, because the gut lining, it's only one cell layer thick. So it's very easily damaged, very easily inflamed. These tight junctions that keep those cells together are very heavily affected by glyphosate, which is Roundup, right? And that is it's everywhere. Even if you're trying to eat organic, it's now in the air, it's in the water, it's very difficult. And we know glyphosate attacks those tight junctions and can cause leaky gut. So same thing in the mouth, we have this leaky mouth. We all have bacteria and fungus and parasites and all these things. These are normal components of our body. So in traditional medicine and dentistry, we're always thinking, kill the bad, kill the bad, kill the bad.
Right.
That's not the way to health, right? We want to consider, how do we create an environment that prevents the bad from proliferating, right? So the way I think of gum disease is, this is an autoimmune condition. So this is something important to understand. Gum disease is a chronic inflammatory autoimmune condition. Autoimmune means your body's attacking itself. And in gum disease, your body is attacking its own bone. And so you're getting bleeding gums, deep gums, loose teeth, right? And this is a result, in my opinion, of toxicity. So in the mouth, ideally, we have a healthy amount of good, bad bacteria. We have a balance. It's not about we only have good and no bad. We have a healthy balance. There's enough nutrients that will provide life to those good bacteria to keep that balance healthy. Now, if we ingest toxins, we get sick with some kind of infection, we have fewer nutrients in our body. And those, I explained it at ECO, like we become hangry, right? Anybody knows, if you've ever been hangry, you're not yourself. Your personality changes, you're angry, you're aggressive. And think about that in the mouth. Okay, now there's no more food, there's no more minerals for these bacteria to survive. Therefore, they become hangry and they literally change forms. It's called pleomorphism. So they change forms into these unhealthy bacteria that can survive in the less oxygenated, less nutrient-rich environment. And now these more pathogenic or bad bacteria, they release these cytokines. I think we've all kind of heard that term over the last couple of years, that initiate the breakdown of the bone and the tissue, right? So instead of just trying to kill the bad bacteria, what we need to do, and this is something that everybody can do at home, you don't have to have a biologic or holistic dentist to be able to do this. So if you think, okay, I've got gum disease, I've got bleeding gums, what can I do to enhance my internal environment so that I can make bring back the good balance of the good bacteria, right? And this has to do with making sure you have enough minerals, right? Minerals are so deficient today in our soil from over farming, from whatever, you name it. And minerals are really the key. If we're thinking about cavities, if you tend to be very prone to getting cavities, it's kind of a different beast than gum disease. And what we know about cavities, again, we all have this bacteria in our mouth that causes cavities. Some of us never get cavities, other of us are more prone.
Right.
What happens with decay, right, is, again, this whole idea of toxicity and inflammation. When we create these reactive oxygen species, which is basically just byproducts of inflammation, they will go into our brain and shut down the production of the PTH hormone. This hormone is responsible for creating the fluid flow in your teeth. So teeth, we also have to think of teeth is actually an organ. Every tooth has its own blood supply, lymphatic supply, nerve supply. Anybody who's had a toothache, there's a nerve in there, right? So it's a living, literally kind of breathing organ. And the fluid that comes up through the lymphatics is what nourishes that tooth. It will bring the calcium, the phosphate up to the enamel and keep it hard and mineralized. Now, when we have a very inflammatory diet, a very high sugar content diet, when that PTH gets turned off, that we're going to have fluid reversal. So instead of putting the minerals into the teeth, we're actually going to leach and pull the calcium, the phosphate, all of those minerals back into circulation to try to neutralize the acidity in the rest of the body. So basically, we're going to sacrifice our teeth to try to save the rest of our internal organs. Therefore, those teeth now are less mineralized. So now they're more susceptible to the normal acids and sugars and bacteria that are in the body. So so often we see a lot of cavities right at the gum line. The gum line the enamel is much, much thinner. There's fewer minerals there. So you're more susceptible to get even you could have perfect hygiene, perfect hygiene, but yet, you're getting these cavities there. And that's a factor of a mineral imbalance and just excess inflammation in the body. So same thing, when you think about going home, we want to try to have an anti-inflammatory diet, right? We want to try to avoid those grains, the processed foods, because that is going to lead to these problems. And now we all have different genetics, so we have different susceptibilities, and maybe you eat the same diet as your husband and you get decay and your husband doesn't. Again, that's that genetic variability that plays into, that's a factor here too.
Wow, that's a lot of very amazing information. I feel like I just got a little course downloaded into my brain. So just to recap for myself and for anybody else listening. So it sounds like the balance of bacteria gets altered in the mouth itself.
Yes.
And this can cause kind of a cascade of certain bacteria or microorganisms changing form into harmful forms.
Mm-hmm.
And then this creates a whole kind of domino effect where the body starts not being able to nourish the teeth and eventually even kind of cannibalizing the teeth in order to sustain like a vital function of your heart or digestion or something like that.
Mm-hmm.
Okay, and this has to do also with a hormone that tells your body when to start doing this.
So the hormone is responsible for the fluid flow through the tooth. This is the parathyroid hormone.
Okay.
Has to do with the calcium metabolism and stuff like that. So that's one of the hormones that's been identified in bringing nutrients to the teeth. So when there's too much inflammation, these reactive oxygen species, they affect the brain and affect the way that the hormones are released. So it affects your endocrine system basically. And that cascade effect then can affect the teeth and the bones as well.
Right. Oh, wow. Okay. Amazing. Okay. So that's pretty clear. And that makes a lot of sense. Actually, I've seen, that's been something that I haven't always been able to think with. You see, a family and they all eat exactly the same, but only a couple of them have trouble with their teeth and everybody else is fine. That was just kind of a imponderable that I thought, well, that's just the way that works. Somebody else might know about it. And well, you're the person who knows about it apparently. So there we go.
And the other part of that is, it's partly genetics, but you're talking about a family whose genetics are fairly similar.
Sure.
But there's the emotional component too, that even a lot of biologists haven't gone there, but I study a lot of this energy medicine, and there are emotions that are associated with teeth too. So, and in order for you to have health and to be pain-free, energy needs to flow freely throughout the body. So what if you have maybe that one kid who's getting more cavities versus their sister or brother? Maybe they have a scar somewhere on their head or neck. A scar is a major interference field. And if energy, again, can't flow properly, then the teeth don't get nourished properly. Again, it doesn't have a lot to do with how much you brush or floss. Our cavemen ancestors did not have toothbrushes. They did not have toothpaste, right?
Yeah.
Ate a whole foods diet, and they had Dr. Weston Price's work in the 30s, showed he went around all over the world, all these different native populations whose diet was very different. But when he analyzed the diet, he found that these people who had perfect teeth, there was no crookedness, no decay, they had 10 times the amount of minerals in their diet and 4 times the amount of the fat soluble vitamins, which those are vitamin D, vitamin A, vitamin K, and vitamin E. So those are really crucial components. So if you're somebody or your child or grandchild is somebody who is prone to decay, we want to make sure that they're not only getting those fat soluble vitamins, but they're able to absorb it as well, because there are some genetic factors, like in my family, we don't absorb our fats very well. So we need to take, a fat digesting enzyme to help us be able to absorb those nutrients properly.
Oh, okay. Makes sense. Yeah, that makes a lot of sense. And I know in our practice, as a health coach, we're often working with people to help them with the digestive piece so that they can absorb, because we have them eating well, but sometimes things stall or whatever. And this is just another piece of, well, has the mouth been looked at as something as part of the digestive tract? So gives me pause to think about all this. And then I also wanted to circle back because you mentioned about energy and emotion. And I know when we're working with clients that sometimes stress is the missing piece that helps a person get to the next level. Like their digestion just won't quite resolve, or they still have fatigue. And we start addressing stress and actually started moving into kind of a life coach function with people to help relieve stress. We've had great results with it. Would you say it would have a similar effect on, the oral health of a person as well?
Absolutely. I've had some patients, where they have a tooth that's driving them crazy, and I can't find anything physically wrong with it. So then I'm looking on my little tooth meridian chart that also has the emotions, and I do a lot of tapping. So emotional freedom techniques, another thing that's very widely available on the internet. And there are certain points on the face you tap, and you can say, you're talking about the patients. I had this one woman in particular who was going through a horrible divorce, and the tooth, just wouldn't get better. And I had her doing a bunch of tapping, and that, helped to resolve some of that pain. And oftentimes we have pain, but there's no physical manifestation. There's no physical reason. And it could be manifesting in the mouth, but it could be coming from somewhere else. I've had a couple patients who had joint replacement surgery, and a week later, the tooth that corresponds to that joint is suddenly hurting.
Oh, wow.
I've seen that a bunch of times. That's, really, really interesting too, that because you have a joint replacement, that's a lot even bigger than a scar. Your energy is not flowing right at all. So Dr. Jerry Tennant in Texas talks about teeth as circuit breakers, right? So this is the main, where you turn things on. So if you've had a root canal is basically a dead tooth. So what we do, the tooth may be because of trauma or because of decay, it infects the nerve. So we keep the tooth, we just clean out the nerve and cover it over so you can still chew on it. But anything dead in the body is going to harbor toxins. Like I talk to patients, it's like if your appendix was inflamed, we wouldn't cut you open, clean it out, throw some rubber in there and stitch it back in your body, right?
Right.
The only profession where we keep dead organs. And right, it was great because we can keep our teeth. Who wants to lose teeth? We don't want to lose. So it's a wonderful idea. And some people can handle it just fine. That's the other thing that's important to know, because some biologic or holistic dentists will say all root canals are bad. And I disagree, because every person is unique. So when you're looking at the person, some people get freaked out. Oh my gosh, I have 3 root canals. I have to get them all out. If you are a person who may have 3, 4 root canals, but you have no health issues whatsoever, then why do we need to take those teeth out, right?
Yeah.
But if you're the patient who has chronic fatigue, fibromyalgia, just all these aches and pains, that's something we need to consider, right? And again, there's a huge emotional component to chronic fatigue and fibromyalgia. But a lot of that can be affected by toxicity and infections, which we can find in the mouth. So you really have to look at every person. We know over the last 2 years, everybody deals with viruses and infections differently, right? It's not about the bug. It's about the body that the bug inhabits. Right. So it's really, really important takeaway for everybody. Like you could get a cold and your spouse doesn't get it. Well, how is that possible? Because your immune systems are different. Right. So that's that same thing with things going on in the mouth. People say, oh, my father had gum disease, so I have gum disease. Not necessarily, and so again, it's individual basis, and there's a lot of factors. And I think that's why people are seeking out more of the alternative medicine avenues, because we are thinking about the entire body, not just looking at, okay, that tooth has a problem, I'm just going to fix that. Or, your back hurts because you have fibromyalgia. So let's just, give you pain medication and send you on your way.
Right.
Let's think of everything that goes into that to heal you totally.
Yeah, well, makes a lot of sense. Absolutely. Okay. So let's say that a person has, listened to you, other people who are talking about how important the health of the body is related to the mouth, and they really want to do something about it. And they've started to notice that they have some gum disease or certain teeth that sometimes are sensitive to cold or something. I know that everybody's different, and this is sometimes a question that, it's hard to answer for everyone. But is there something that a person should do as far as like a step 1, 2, 3, all on their own? Something like
Sure,
that.
absolutely. And there's so much you can do on your own. If you have a broken tooth, okay, you're going to need a dentist to fix that. But if you have inflamed gums or some gum disease, the first thing you want to do is change what you're cleaning your mouth with. Okay. Our environment is so full of toxins. And on the top of that list are like beauty products, cosmetic kind of products. So I am not a believer in any of the mouth rinses whatsoever. They're just chemical waters, right? Especially blue. Nothing blue is natural, really, right? But
Right.
acid blue is not natural.
Yeah.
And so you want to switch to something that's more natural. One of the toothpaste I really love is called Revitin. And what's interesting about this, and I was doing my own little experiment. I had my own study that I was doing on my gum disease patients. So there's the test you can do, and it shows you what kind of organisms are in the mouth. And I was doing this years ago, but didn't matter what bugs were there. The recommendation from the company was always the same: antibiotics. And I was like, well, why am I bother wasting people's money if they're going to tell me the same, recommendation? So then, when I started understanding more about how gum disease manifests and what I could do to prevent it, I said, all right, I'm going to use that test as a beginning and an end. So we did it at the beginning, and then I had a couple of different groups of people and things that I was giving them. So I had one toothpaste that was a natural herbal toothpaste, but its idea is to kill the bad. And I used Revitin, which is when I first purchased it, I was thinking that it was more of a remineralizing, so for cavities. But what that toothpaste really is, and when we were talking before about the environment or, natural medicine, we talk about the terrain, if we can improve the environment of the mouth, right? We put the nutrients back, then the body's going to heal. And this is exactly what I saw with Revitin, that immediately the mouth got better because it's full of prebiotics, right? Which are the food for the good bacteria, as vitamins and minerals. Now it's different because it doesn't suds. People are used to, the suds to feel clean.
Yeah.
It does take a week or so to kind of get used to it, because you got to think about what we're doing is we're changing the whole environment. So I've had a lot of patients be like, didn't like it at first, but now I really like it, because again, it's a totally different way of thinking about cleaning your teeth. There are a couple other tooth powders that I like to, just as long as there's not, any chemicals in it. We don't need any of that. And even fluoride, that's very controversial, but fluoride is not a natural component in teeth. There are some studies which show, topically it's good because basically it's poisoning the bacteria in your mouth. So if you poison bad bacteria, they can't, do what they normally do. But I don't think that is an absolute necessity to have a healthy mouth. I don't personally use it. I don't give it to my children. And so that's the first thing, right? Is get rid of all the chemicals. Okay. And then if there's inflammation, think about your diet. What are you eating? A lot of processed foods? Are you eating because you're so busy? Are you, and granted, we all are. I don't know anybody who eats perfectly.
Right.
But the more whole foods that we can eat and the fewer processed things, that's another really, really important step too. Making sure you're getting those fat soluble vitamins. So for children, I love giving them, my kids take cod liver oil. I mean, it sounds terrible, but there was a reason why our grandparents used to eat it.
Right.
And you can buy lemon flavored, bubblegum flavor. And I kind of do the Mary Poppins thing with my kids. And I got a fancy baby spoon and they take their cod liver every day, but adults, the same thing. And you can get good quality ones in a capsule as well. So that's what I use, grass-fed butter. So grass-fed butter or ghee is very, very yellow, and that's the vitamin K. So really, really important. You can't really take one vitamin or mineral by itself. All vitamins and minerals work together. So, back in the day, they did this huge study, right, with menopausal women taking calcium and vitamin D. And they had to stop the study because a lot of women ended up with heart attacks. Because without vitamin A, without vitamin K, without magnesium, that calcium doesn't get deposited in the right place. You need the vitamin A and the vitamin K to pull the calcium away from circulation and away from the tissues to put it into the teeth and bones.
Wow.
So that's really important. So a lot of vitamin D supplements you see now will say D3, K2, because we realize the importance of having that K2 with the vitamin D so that the calcium is brought into the proper place in the body. So getting a good toothpaste going. I can just like simple hydrogen peroxide, right? You dilute it, the $3 bottle that you get, it's usually in most people's, medicine cabinets, diluting that 50-50 and swishing with that is a wonderful way to get oxygen, right? Good bacteria need oxygen. They thrive on oxygen. The bad bugs, the anaerobic bugs, as we call them, right, they live in a less oxygenated environment. So hydrogen peroxide, in my practice, we use a lot of ozone. And that's, again, another way to get good oxygenation. You can buy nasal sprays of oxygen, anything you can do that's going to help promote good, healthy bacteria. Probiotics, right? There are plenty of oral probiotics. I don't think it really matters. But again, both the mouth microbiome and the gut microbiome are very similar. Think about it. You're swallowing that all the time, right? So they're intimately connected. So you can take a good probiotic. It's going to help because, again, it's the same kind of tissue. So probiotics are important. The other big thing, if you have decay or gum disease, is a binder. So on this little study that I did, I had patients on an oxygen product, on Revitin, on a probiotic, and on a binder. So the one I prefer is Biotoxin Binder by Cellcore. And it's just amazing. Like all of their products, I like their CT Biotic product as well. And they have an oxygen product as well. So the binder, because you want something that's going to grab on to the toxins that those bacteria and fungus and whatever give off. And you want to grab it and take it away. So we can do a lot of things that will get rid of toxins, but if we don't bind them up, they're just going to get recirculated and cause problems. So all of those things you can do yourself, you do at home. If it's a Cellcore product, you have to find a practitioner who will get you that, but there are other binders like charcoal and zeolite. They're not, in my opinion, not nearly as strong or as effective as the Cellcores, but if that's all you can find, go for it.
Awesome. Okay, great. Wow. That's pretty comprehensive and a couple things in there that I'd like to start doing myself. So awesome. Okay, great. And I'd like to just give a little plug for the Revitin. After I heard you speak last year, as I mentioned at the Cellcore seminars, the ECO, and that, just for everybody listening, that stands for Exponential Clinical Outcomes. And it's a seminar that Dr. Carver spoke at. And my wife and I started using this toothpaste, and we had a similar effect to what you said. It doesn't foam up, and you don't get that. I think it's like kind of almost a mental piece. We've been programmed to think if it doesn't have a foamy effect, then you're not cleaning something. But after a few weeks, the mouth feels more balanced, and we noticed that the kind of clean feeling lasted longer. Right. So that was our experience, just to give a plug on that, because we do like it a lot better than our previous ones. So yes. Awesome.
And I have no financial bonding to any of these products. So, so it's personal preference and what I've seen work. So
awesome. Yeah. No, neither do I on Revitin. I just use it. Okay, great. This makes a lot of sense. So I wanted to just ask you a couple questions that came to mind as we were talking. So you've mentioned a couple times about drainage in binders. And I feel like this is a little bit like we know about cleaning our teeth. And, I think oxygen is pretty well known how valuable that is, and eating well, having the vitamins. But what is the drainage piece, and what does it have to do with binders, and how does that affect the mouth?
So really, really important for drainage. We talk about detox. Most people are familiar with the term detox, right? Yeah. And I know in my own health journey, before I didn't understand what drainage meant. And so I would do these detoxes, or, we talk about 10-day detox, 21-day detox, and that's great. But if your drainage pathways aren't open, so meaning your bowels, like if you're constipated, that's no good. Your kidneys, your liver, and if you're not sweating, I remember I couldn't sweat. I bought a sauna, I'd sit in there and I wouldn't sweat until I kept using it repeatedly. So my drainage pathways were blocked. So I would try to detox, but nothing would come out. It would just move to a different place in my body, right? So if we're taking binders can be a little constipating. So it's really hydration. That's another really, really important factor in chronic disease in general. Most of us are chronically dehydrated. Even though we may not feel thirsty, maybe we don't have the typical signs of dry mouth or dry skin, but that's really important because we live in such a toxic world. and our kidneys and liver are working overtime, that the more hydration you get, the better, So when we're taking these binders, and for gut health, right, hydration is crucial. So since this is part of the gut, we need to make sure, and how do you know if your liver and kidneys, that's a hard thing to know. You can know if you're going to the bathroom, but sweating, you can know if you're sweating. Kidney and liver, that's a little bit, challenging. Sometimes, if you have chronic low back pain, that could be a sign of dehydration. I know that happens to me when I get dehydrated. I wake up in the morning and my low back, and as soon as I get up and walk around, I'm fine. But that tells me overnight my kidneys were a little bit overloaded. Maybe I didn't have enough magnesium. I didn't drink enough water. So that's another thing I do every day is I take electrolytes every day. In addition to a bunch of the other things I do, I'm always taking those electrolytes to make sure electrolytes help us absorb the water. Because sometimes you can drink all the water you want, but it just goes right through you. Yeah. You need to have that right balance of the sodium and the potassium to be able to absorb that. So that's important. So hydrating, making sure, you're draining. And if you're the kind of person who maybe you do a detox, but then right away you feel worse again, that could maybe be a sign that your drainage pathways aren't open. So you need to, seek out a provider who can help you investigate that further.
Nice, makes sense. And do you have a product that you recommend for the electrolytes or something you like to use?
I use the Ultima brand. I buy them just off of Amazon. They have all different flavors, so I like to change it up. There's a other brand called LMNT, and they're very, very salty though. Yes. But it works really well, but it's super salty. Yeah. And let's see there's also IQ. I don't know if anybody's familiar with IQ bars, but they also have they're mainly for like people who are in the paleo and ketogenic lifestyle. They're mainly healthy fats, and they have one called IQ Mix. Those taste even better than the Ultima, and they actually have some mushrooms in it. So there's I think it's lion's mane. So if anybody who suffers from brain fog a little bit, those ones I like that a lot too.
Nice. Yeah. I found with the electrolytes, the LMNT are really good after you've been exercising because it replaces that sodium level. Mm-hmm. And then the other two you mentioned seem to be something you can just take regularly to keep things balanced. Yeah. Right. Awesome. Okay, great. And then I always like to ask, so let's say there was one thing that you could give to the world and there was nothing stopping you, and it had to do with helping people improve their health and longevity and whatnot. What would you focus on? What would you pick?
I think I would really pick the energetic component, the stress reduction, and kind of like what is, it's a kind of a big question, but what is your purpose in this world? Because when we are aligned with our purpose, everything comes to us, everything, joy, happiness, money, you name it. When you are aligned with your soul's purpose, which again is challenging, how do you figure that out? But energetically, when we're in line, I love to do things like Qigong. I'm not great at meditation, but just even taking a few minutes every day to do deep breathing. If there's one thing that's absolutely free and incredibly profound for overall health, is taking a few minutes every day to do a few minutes of very deep breathing. That's going to turn on that parasympathetic nervous system. And that's the nervous system that helps us relax, repair, regenerate. In this crazy world, we spend way too much time in the sympathetic nervous system. And so we are all so stressed. We can't sleep. Sleep is when we're supposed to get into that resting, and we don't do it. So simply breathing, and awareness. My front office, they have big signs on their computers that say, be mindful. Right? Nice. When we are mindful, we are kinder, we enjoy life more. It doesn't have to be a rat race. And when you are in that nervous system, all your health ailments can go away. You cannot, if you are not in that healing state, I don't care how many organic vegetables you eat, you have to be in that state to allow. And the other thing to remember is nobody and no thing can heal you. You can heal yourself, but you've got to be in that mindset.
Wow. Super powerful. That's awesome. It's so interesting. have the wonderful opportunity to interview people who are very knowledgeable and who are actually practicing in dealing with the real world and using their knowledge to help people. And when I ask this question, so many people have a similar answer, that the underlying factor is being involved in a purpose and in tune with what you want to do. And that's where it all starts. All these other tools we have can be inhibited so greatly if we're not able to engage in life in a way that doesn't create stress, doesn't create friction, and all these different factors. So I just wanted to mention that, I totally agree, and a lot of other people do as well. So that's awesome. Yeah, and then as far as giving people something that they can walk away with, I just want to kind of do a quick recap and let me know if I miss anything, of course. So we have at the kind of the top of everything, making sure that you're not overstressed and that you are involved in things in your life that give you purpose and allow you to engage in things in a happy way. So that's at the top. And then going down from there for oral health, we really want to make sure that we are using products that don't add toxicity to our body and specifically to our oral health, and using things like toothpaste like Revitin, and then following that with a really, it's kind of a logical diet. We know which foods agree with us, and we know which things are refined, and things that have bad oils or too much sugar, we just avoid those and eat a wholesome whole food diet. And then follow that with binders and making sure the drainage is occurring. And this could be in the form of something from Cellcore, like biotoxin binder, or a charcoal product, or whatever it is. I agree with you. Cellcore's products are amazing and the best on the market. So use those if you can. And then the other thing is just maybe working with a professional who can actually help you take things to the next level if it's beyond what you can handle, or you've done as much as you can, or you just want that help right from the get-go. And speaking to that, what are some of the things to help a person find someone who is similar to you, able to help them in a way, or even contact you or your office to help them?
Yep. So I can be reached. Best way to reach me is my email, which is just Dr. Dr. Carver at carverfamilydentistry.com. And there are two organizations that most biologic, holistic minded dentists are members of. One is the IAOMT.org. And the other is IABDM.org. So one is the International Academy for Oral Medicine and Toxicology, and the other is International Academy for Biologic Medicine and Dentistry. So both of those, I'm accredited through both of those organizations, and they have locator things on their website, so you can find somebody who's near to you, or feel free to reach out to me. And I am building, a network, knowing, where people are located and trying to get people where they need to go. But again, a lot of it you can really do yourself, at least get you on that right path, except obviously if you want your, amalgam fillings replaced, or you need teeth out, obviously you need the dentist for that.
Right.
But the more you can do upfront, and when my patients come to me, I'm putting them on programs before I'm doing the dental work, because like you said, we need to have the drainage open. We need to make sure they're bind, because we don't want to start taking things out of the mouth, stirring up some inflammation, and then the person get worse. So there is always lead up. So the more you can do on your own, and sometimes you need to work with a practitioner who can help you with these kind of protocols to get your body ready for these things. But a lot of things, like I said, you can do yourself.
Nice. Awesome. Great. Amazing data. Thank you so much, Dr. Carver. This has been really amazing, getting all these tools and practical knowledge that can be used, and information that is actionable and effective and proven, because you've worked with so many people and gotten so many amazing results, of course. So thank you so much for being here today. Thank you for being here with me today on this episode, helping others create a happy, successful, and healthy life and lifestyle they enjoy. It's a major purpose for me, and I'd love to share more with you. so you can improve your health, success, and happiness. Please check me out on Instagram at Longevity Fitness and Health, or Facebook, also at Longevity Fitness and Health. You can find my Facebook group there for flexible fasting, where you can learn amazing techniques to begin fasting and using the tools of fasting in your life. You can also reach out to me directly by email at info@longevityfitnessandhealth.com. Again, thank you for being here today. I hope you have a great day. All the best.